Good evening, everyone, and welcome to One Healthy Boston's Facebook Live. I'm Kristen Perfettio. One Healthy Boston is a community resource that was created to help you achieve overall wellness and good health. It's brought to you by WCVB TV and South Shore Health. And tonight we are talking about urgent care, and that's why I am joined by Dr. Chris Whalen. Urgent care can consist of that minor cut and scrape to maybe a broken bone, but we're going to get right down into the nitty-gritty of it and what it is and how it can benefit you at home. Welcome.
Welcome.
You excited?
Thank you for having me. Very excited.
I'm so excited to have this tonight. Before we get into this topic, I would really love our audience just to learn a little more about you, Dr. Whalen. Can you tell us a little bit about yourself?
Sure. So a little background. Graduated medical school in 1989 and went on to do a combined residency in internal medicine and emergency medicine. And then from there went on to practice in emergency rooms anywhere from South Carolina up to Massachusetts, most recently at Cape Cod Hospital until 2012, at which time my partner Michael Hughes and I opened up Health Express in Weymouth, which is an urgent care, and then expanded to several other locations on the South Shore.
So not only are you a doctor, but as we said, you are president of South Shore Health Express, and your expertise, if you will, is the business of urgent care.
It has become that way. It was all medicine before, but I have had to learn the business over the last 6 years.
Yeah, so for folks at home who may not be familiar with urgent care, what exactly is it?
So my partner and I thought of it as a different place to go other than an emergency room, because emergency rooms were your only option as of 6 years ago. And there's so many people that go into emergency rooms that don't need that higher level of care, and the expense on the insurance, the expense to the family was near outrageous. So our plan was open an urgent care and make it a little different, because all our providers are either trained in emergency medicine residency programs, it was 100% at first, or now we've hired nurse practitioners and PAs as we've opened more spots, but all of them have extensive experience in the emergency room. So we try to act somewhere in between the emergency room and say a more basic, for lack of a better word, minute clinic, which doesn't have all the capabilities that we have, just as we don't have all the capabilities that an emergency room has.
But it sounds to me like you have quite a few of the providers that an emergency room may have, right? You talk about doctors and nurse practitioners and people who have expertise in that certain area. Can you talk a little bit about that?
Yes, so I feel the advantage there is, A, we will very quickly recognize those who have missed triage to an urgent care, which could be a problem, right? Someone comes in with chest pain and they're having a heart attack, we're not the place for them. Or if they have an abdominal catastrophe going on and they need a CAT scan right away, we've seen that 1,000 times in the emergency room, so it's a big advantage. Other cases like a laceration to the face, as my partner and I used to say, we could sew it for you here and get you out in 45 minutes, or we could do it in the emergency room, and we all know how long that can take due to all the other sick patients there. Mm-hmm. So I think we do offer more in terms of patients' care at our urgent care centers.
And I know I forgot perhaps to mention earlier when I introduced you that we are welcoming our viewers to send in questions. If they have anything that they want to ask about urgent care, Dr. Whalen can certainly do his best to answer that. But we do invite our viewers to send in questions now on that topic. Getting back to urgent care, would you say that this has been growing and trending over the last few years? It's definitely becoming more of a hot button or a hot topic issue with our people at home?
Yes, it's a very growing market in Massachusetts in general. We were the first standalone urgent care, I believe, opened in 2012, mm-hmm. And since then there's probably 14 on the South Shore and another 30 on the North Shore and heading west. So it is a big market because people realize the advantage to the consumer and to the healthcare dollars in general.
So talk a little bit about the advantages of that. I mean, convenience has to be something that is the draw, right?
Yes, our three big draws are convenience, time spent. You can walk in, there's no appointments, you're seen immediately. Our turnaround time is less than 45 minutes. If you're there longer than that, it generally means that you had an IV or you had a laceration that had to be closed. So you understand why your time is being spent. But it's very important for us to deliver on our goal of timeliness. Everyone is so busy nowadays that we need to deliver a good product, an excellent product in terms of care, but in a short period of time.
And you did just address that question, but just so that we cover it again, you don't need an appointment when you go into urgent care, correct?
You do not need an appointment when you go into our urgent care. Some models do play with that idea, but we felt it wasn't fair because if someone's been sitting there for even 5 minutes and someone walks in the door and goes ahead of them, they feel a little put off. So our answer is that we just have to have enough providers that people are seeing in a short period of time.
Okay, so let's get back to some of the key differences. Actually, let's take this question too from Lucy before we move on. What are the copays, and are they more or less?
So copays are driven by your insurance. We are generally considered tier 1, so we'll be your lowest level copay, which for some people is $10, some people $20, versus an emergency room. I mean, I'm only speaking to my own insurance, but it's $250. So I know for me it's $20 to go into urgent care, and I know it's $250, and I have a good health plan, but that is what it costs. Because the back end costs are 5 times to 10 times as much as an urgent care.
And when people come in to be seen, are there particular things that they should bring with them, like their insurance card, that type of thing, the copayment at the time, or is it billed? How does that work?
So everyone should have an ID. You have to have an ID to be seen, a Massachusetts ID, and then we will bill their credit card when they come in. And then on the back end, they'll get a bill for the balance they owe, and sometimes it could be nothing if your insurance covers it all. So we get their insurance information, their ID, we bill for their copay, which you can look up on an online system. So we know exactly what their copay is, and we confirm it that way. And then they'll get a bill on the back end 2 weeks, 3 weeks later.
Okay. I would really like to get back to the differences between an emergency department and urgent care. You know, what are some of those key differences that would make a big difference for a patient who needs to be seen?
Basically, if you need an ambulance, you need an emergency room. Now, some people overuse ambulances, so it's not always a true statement. But if you're having chest pain, then we're worried about the heart. We can't take care of the complications or even the diagnostic workup for that. We don't get blood tests back in 10 minutes like an emergency room. We get blood tests back the next day, so we only do blood tests when we really need an untimely result. If you're having some catastrophic thing going on with your intestines, the standard of care nowadays is basically a CAT scan. We don't do that type of stuff. We have x-ray, but we do not have CAT scans or MRIs. So if you're very sick, you would go to an emergency room. But there's numerous cases in between that can come to us.
So a patient, if you will, that has needs constant follow-up or needs to be monitored for a certain condition, this may not be the correct venue for them, right? Like,
yeah, correct.
Okay.
We do not have cardiac monitors in our place. We have an EKG machine, and we'll often do that. And then if it's abnormal in any way, we will forward the patient to the emergency room.
Okay. So talk about a little bit, well, we have a nice question. We have several people that are asking, do you need referrals?
You do not need a referral to be seen in an urgent care, except for the new model with Mass Health with the ACO plans. Some of those require a referral, and we try doing that in real time for you at the desk. So those are the only ones. Pretty much Tufts, Harvard Pilgrim, Blue Cross, that's going to cover 60% of the insured patients in Massachusetts on private insurance. They don't need a referral. General Mass Health doesn't need a referral. So generally, no, you don't need a referral, but we'll let you know up front if you do.
Okay. And patients, again, I didn't realize this until recently, you do stitches there, right? I mean, I always just figured that you'd have to go to the emergency room to get stitches, but you can do stitches. What about broken bones? How do you deal with those types of scenarios?
So it's always up to the individual provider, but we absolutely do stitches and lacerations, and anything I would have done in the emergency room for a laceration, I will certainly do at my location, and so will our other doctors and providers. In terms of broken bones, it's pretty much the same treatment you get in the emergency room. If someone has a compound fracture, meaning possibly bone sticking out of skin or something like that, that's clearly a fracture that needs to go to the emergency room. But if your kid punched a wall or he fell in a football game and has a small, simple fracture, we're going to splint it, and we're going to get, because we have good relationships with the orthopedics on the South Shore, we're going to get you an appointment in the next couple of days for a cast, which was the same exact thing we did in the emergency room. So it's quite efficient, and we have x-ray right. It's one of our rooms. So we have 6 or 7 rooms in every facility. An x-ray room is right there. So I see you, I order an x-ray. This whole process is 20 to 30 minutes.
Perfect. We are One Healthy Boston Facebook Live right now. We are talking about urgent care this evening. I'm joined by Dr. Chris Whalen, president of South Shore Health Express. We do invite you to send in your questions if you have any questions about urgent care and the topic tonight. We'd love to hear them. Michael, that was a question from Michael and Phil. I think I just missed that. Can you lift that up again? Oops. let's see, can you do surgical procedures, IVs, that sort of thing?
So we certainly don't have an operating room, so the minor surgical procedures we would do would be lacerations, or patients have an abscess for whatever reason and it has to be drained. We'll certainly do that. IVs will absolutely do. It's flu season. One of the complications of flu can be dehydration and nausea, vomiting, so we'll put an IV in. We'll give you nausea type medications IV. We have IV antibiotics we can give if they're indicated. So we're not doing any major operations, but certainly we can do the simple things that were done in the emergency room.
Let's talk a little bit about, you just mentioned the flu. It is flu season, and I'm sure emergency rooms are starting to see that influx of patients coming in, you know, thinking they might have the flu, they want to be tested for the flu, that kind of thing. You know, what should patients do if they are in that bracket? I think I might have the flu. Should he go to the emergency room, or should they go to urgent care?
Well, you should only go to the emergency room, once again, if you have a life-threatening illness. Generally speaking, the flu is not life-threatening. The people that are most affected or most worrisome to have a life-threatening complication are the elderly, the very, very young babies, less than 2, and those with comorbidities like heart disease or asthma, etc. But the marker for that is going to be that you have severe respiratory distress, which means you're developing a pneumonia, or you're severely dehydrated and fainting. Mm-hmm. So if you just get a cold, like right about now, frankly, if you're getting a cold, it's getting more likely that it could be the flu, especially if you've been around anybody with the flu. Starting last week, we started getting an influx of patients with the flu and a lot of positive flu tests. If you get seen within the first 48 hours of getting the flu, there is medications, antivirals we can give you that will help lessen the duration of your illness. The flu shot also is quite imperative. If you haven't gotten one, I highly recommend you get it. There's a fairly good match with the flu that's coming out this year. So if nothing else, you'll mitigate your symptoms to some degree.
Okay. And as far as you talked about being able to give them medications, or prescribing them medications, there is no pharmacy at these urgent cares, correct? It works just like a primary care physician, right?
Yes. So we see the patient at the front desk. Magically, their pharmacy information was put in by our front desk staff, and when I discharge a patient, I go into my electronic medical record and I zap over through the magic of the internet the prescription to the pharmacy they want to go to, and generally it's there within 45 minutes waiting for you. So it's very convenient for the patients.
And are you hearing that from a lot of patients who come in like, wow, this was so much faster than I thought it would be,
Yeah, I think that's been the biggest message that we've gotten back in the 6 years we've been in operation, and the reason we went from 1 center up to 7 centers. It was just patient awareness, and patient expectations were met, and they came back. We have a lot of repeat visitors.
And ideally, this is how you would like the health practice to be, is that people save their most emergencies for the emergency room, and the more minor things for primary care or yourself in urgent care, correct?
Yeah, great. I think your first call should still be to your PCP, and if they're able to see you in a timely manner, go see them. They're more than capable of taking care of a lot of this stuff. They might like us if it's an x-ray problem because they know we have x-ray on spot, but we can all work together. We do not do primary care. I do not treat high blood pressure. Mm-hmm. I know how, but I don't. We don't do yearly physicals. So we are an add-on to the health system. We're not to take the place of your PCP.
Okay, we do have a question from someone who is asking, compare Minute Clinic to urgent care.
So Minute Clinic is CVS. Mm-hmm. It's a good opportunity for patients at a lower cost than the ER. They are limited in terms of what they can take care of. They do not have x-rays. They can't do a urine culture on your urinalysis if that's important. If you have a pneumonia and need antibiotics right away, they can't give meds like that right on the scene. So Minute Clinics definitely have a place, but they don't have the capabilities that we have, just like we don't have the capabilities of the emergency room.
Okay. I'm thinking of new moms or parents at home who have children. What are some of the things they should consider bringing their kids in for urgent care? I mean, there's the typical, I feel like 2 a.m. phone call to the doctor about do they have an ear infection, those types of things. Is that what you're seeing, and why would they bring their child in?
Child's pulling or tugging at their ears. They're worried about that. Child's coughing nonstop. They're worried about the child having a pneumonia. The child develops a rash. Is this a bacterial rash, cellulitis, or is it just a viral rash, or does it have any other implications? So I think the same thing they take them to their pediatrician for. but sometimes the pediatrician isn't open. It's weekends, after hours, so we are open. We're open to 8 o'clock at night, so a lot of times when people need you, we're around.
Okay, we do have a question about, does HMO cover urgent care?
Yes.
Okay, easy enough.
Absolutely. Yeah.
Easy enough.
Yeah.
You were talking about hours just before we took that question. I know you say that you're open until 8 p.m. most of the time.
So Monday through Friday, we're open 9 to 8 at all our centers. And on the weekends, we're open 9 to 4. There's a couple new centers we're open at 10 at just because the volume hasn't built up yet. And it's probably hours we will extend as the demand grows.
Well, that's what I was going to ask you. Do you ever foresee maybe an overnight type urgent care, which again would help ease the burden of emergency rooms?
Oh, you're making me cry a little bit. Those nights really hurt in the emergency room. The perfectly honest answer to the question is, I think when we're dealing with these urgencies, the whole point is people could wait to the next morning, just like they didn't need to go to the emergency room. You don't necessarily need to be somewhere at 12 a.m. for this problem. Go in the morning at 8 or 9. So I don't think there'll ever be a need for these things to be 24 hours, but in this market, I wouldn't be surprised if someone says it's a good idea.
Yeah, we have somebody who's asking where your locations are.
So we're on the South Shore. South Shore Hospital just took ownership of us, but we have the first place was in Weymouth, then we have one in Pembroke, we have one in Plymouth, we have one in Kingston, Abington, and Quincy. So that's where the 6 that South Shore has ownership of are located.
Very exciting. You've grown over the years. Exciting.
Yes, yeah. They see on average about 50 patients a day, and we could double that if need be, but there's a lot of PCPs in the area, so I don't see numbers going much higher than that, but we can certainly maintain that easily.
So walk me through what a typical visit would be like if someone comes in, from, if you could, in start to finish, what are they going to expect when they walk into the lobby?
So we were very, very busy on Monday, and so there's only one provider scheduled. I was there, and we have a system whereby we have nurse practitioners or doctors that will float. So they'll go to any location that's hyper busy. So I was floating on Monday, so I went to Weymouth, and we saw like 90 patients on Monday. But this general theme was flu, flu, flu. People were coughing, had a cold. Some people would need x-rays to keep them there longer. So as I told you before, it's really important that these people get turned around in a quick manner. So that's why we have the float system. So the patient doesn't sit in the waiting room waiting for one doctor to have to go through that many patients. It's just not possible. So the theme of that day was cough, cold, runny nose, but getting worse. And I'd say we diagnosed 10 people with flu on that day alone.
And what's the patient experiencing as they walk in? They're checking into a normal reception type area, kind of like talk me through your facility.
So all our facilities are built out the same way. They're kind of, my sister Kathy was actually our decorator. I think she called it medical chic or something like that. But you walk into a granite high top desk. There'll be 1 or 2 people triaging you and getting your information. And then you might not even sit down, and you'll be taken right back to a room if we have one. That's the idea. And then you go in a room, and a second person will meet you. That will either be an x-ray tech or a paramedic or a nurse or a medical assistant. And they'll get your history. They'll find out why you're there, your list of medications, and past medical and social issues, so they can put it in the chart. And then all of a sudden I see it on the board, and there's a patient in room 3, and I go see him. And that whole first process could take anywhere from 5 to 10 minutes, and then it's me having a conversation with you however long it takes for me to feel comfortable with what your diagnosis is. And do you need some more tests? Do you need a flu test? Do you need a chest x-ray because you didn't sound right? So that's pretty much the whole process. And then I write up some papers to have you discharged home, and I go see room 4.
It's very quick.
Very quick.
And so convenient.
Yeah, that's the goal.
Yeah. Stacy has a question. She says, thanks for your great care today in Plymouth.
I wish I could say I was in Plymouth today, but thank you whoever was in Plymouth.
That is great. Thank you so much for that comment. So your providers are familiar with all of your locations, is that correct? Because you do talk about how you kind of go from one to another, or you're positioned in, one in Plymouth one day, maybe in Weymouth the next.
I'd say most people have a home. Like in Plymouth today, I could probably guess the one of the 3 doctors that took care of the patient today. They were all doctors who formerly worked at Jordan ER. We have probably two ER doctors that work at Weymouth and Pembroke. So some people float around because they like it, and some people want to stay in one place. So when I put the schedule together, I just try and make everybody happy.
when we are with Dr. Chris Whalen, who is president of South Shore Health Express. We are welcoming your questions today because we are talking about urgent care, a topic that you are probably familiar with and we're trying to get others familiar with. It's a service that is growing. Let's go back to the providers. You say that they're trained in a variety of things. Can you touch base or talk about that?
So emergency medicine as a specialty, I'm not going to have the exact correct year, but I'd say it was late 70s, the first emergency medicine residency opened. And the idea of that was you would go into the emergency room and you might see a surgeon one day and an internist one day, but the internist wasn't necessarily great with surgery and the surgeon wasn't necessarily great with internal medicine. So our residency was born, emergency medicine. So now anybody who works generally in any emergency room now has to be board certified in emergency medicine. So every doctor you see at South Shore Hospital ER, I assure you, is board certified in emergency medicine. So Mike and I decided to take that model to urgent care, and at first all we had was board certified ER doctors, and as we've expanded, we've hired nurse practitioners and PAs who once again have had many years experience working in the ER. It's a great career, but it's a taxing career. You do nights, you do late evenings, hours all over the map, so it is taxing, and you see very sick people. So I always thought of this as a nice segue. I was turning 49 or 50 as a nice segue where I could still do interesting work and even see some emergencies, but not necessarily have the toll on your body that you feel in the ER.
Well, it's interesting, and she's probably listening now, but my mom was an emergency department nurse for over 30 years, and the clinic, an urgent care clinic, was a nice transition for her to move out of that. Yep. and just still keep her hand in emergency medicine. So it was a
that means in your childhood you were never sick.
But I had every medical supply at my fingertips. Yeah. I have a question from Rosie. Does Medicare cover a visit? And is there a chance to review all payment options?
Sure. So Medicare covers 80% of your visit. A lot of people have Medicare co-insurance, whether it be United, Cigna, Tufts, and that will cover the other 20%. If you do not have co-insurance, then you will get billed 20% of the bill afterwards. We do not take a copay for Medicare because we really don't know what the copay is. Unless they have a co-insurance, then we take the copay on the co-insurance. Mm-hmm. We take every insurance there is in Massachusetts, to my knowledge. We also do workers' comp, we also do auto insurance, and we have a self-pay option. There's still people, even though Obamacare got us all insurance, there's still people that don't have insurance, or for whatever reason, maybe it's a really high deductible and they don't want to use it. We have self-pay options. It's $135 to be seen. If you get an x-ray, it's $30. If you have a laceration, it's $60. These are all affordable costs, and your average bill is going to be probably less than $200 in general. Mm-hmm. So there's options for everybody there.
Okay. We have a question from Amy. Can you do x-rays?
Yeah, so we have a licensed x-ray tech at every single facility, and we have an x-ray machine at every single facility.
And when you get an x-ray, how quickly do you get those readings?
So the ER doctors generally read their own films, so we read it on the spot, and I'll tell them it's broken, but all our films get sent to a radiology firm, and if we want something stat, we get it in 10 minutes. If we don't need it stat because we know nothing's broken, then we get it back in anywhere from 12 to 15 hours. And then we check all those against what we read it and what it was to make sure we didn't make a mistake.
So, and let's talk a little bit about the follow-up after an appointment. Say, again, a child has an ear infection and you've given the prescription for meds, or someone's had an x-ray because they think they have a broken ankle. You do follow up with their PCP and orthopedics, correct?
Yeah, for orthopedics, I almost feel like we have a concierge practice. We literally have relationships with orthopedists on the South Shore, and we can get pretty much anyone in within 24 hours, which I think is amazing. With some things, you don't necessarily need follow-up. If someone has a simple sore throat and the strep is positive and you put them on the antibiotic, you tell them the follow-up, if it doesn't get better as you predict it will get better in the next 2 to 3 days. But just the follow-up for the sake of everything being fine is not necessarily helping anyone's pocket.
Okay. Donna has a question. How many nurse practitioners are at your urgent care?
Oh, I won't have an exact number, but I'll say, off the top of my head, I can think of 6. So, but that's all. We have 6 sites, so But I think 6 nurse practitioners and probably 3 PAs. That might be our full staff of nurse practitioners and PAs.
Okay. So with today's world of instant gratification, do you think that primary care will ever be replaced by urgent care?
Never.
Talk about that a little bit.
Well, we can't see someone for a yearly physical. We won't be paid for it. Insurance will say, no, you're not allowed to do this. We can't see people for follow-up with their hypertension or diabetes. It's not, I don't even have a fee schedule that I could bill for that, so we can't see those patients for that. And we do have to turn people away. They'll come in for their yearly physical and we just say, we can't do it. I mean, if you want to pay out of pocket, but that's silly because your insurance covers you to get that done with your PCP. So no, the PCP is still the hallmark of the healthcare system.
Okay, and Amanda has a question. What if I have no insurance?
Amanda, you would then fall under the self-pay option that I'd gone through before, but a basic flat fee rate of $135 will generally take care of most things unless you have a laceration or a broken bone. Then of course you're going to need some more things done, but they're priced correctly. An x-ray is $30, which is much less than it would be anywhere else.
Okay. Talk a little bit about, again, you had mentioned, parents bringing in children for ear infections and so on. What are some other things that you're seeing that are helpful to parents with their kids and why urgent care would be so important for them?
What else do we see kids? With kids, it's generally a fever, right? Mm-hmm. That's the mark for the parent and the kid being fussy. I think what they want to know from us is that we're not talking about an impending meningitis case or some life-threatening illness that could affect, obviously, their child. So I think it's reassurance a lot of times, especially if it's new parents, first child. But we can see them in a timely manner. Like a lot of families have two incomes now, right? Mm-hmm. So it's just really hard to do stuff in the middle of the day, and so you
encourage them to go to their PCP.
So we do athletic sports physicals. And that's basically happens because the MIAA does not line up necessarily with your yearly physical, but that's priced at $30. So it's a convenience for people. I have to play basketball on Monday, but I don't see my doctor until February. You're not going to be able to make that work. So we have a sports physical that we'll do very quickly on them. But yearly physicals, once again, that would fall in the PCP.
If you have a patient that comes in and presents with what would you think would be chest pain or needed emergency care, do you offer transportation, or how does that work when you're in an emergent situation like that?
So as I tell all my providers, the sick patients back in our ER days are really the easiest case for us. I walk in the room, I hear the case of chest pain, I have an EKG happening as I'm talking to him. That EKG is abnormal. I walk out of the room, I tell them the front desk to call 911. I start putting together a chart for the ER. I tell them to give some aspirin, put an IV in, maybe we'll give some nitro. But I would like that person out of my emergency room and in the ER in the least amount of time possible because I am doing no good for them other than getting them to the right place.
Okay, so we are here with One Healthy Boston Facebook Live with Dr. Chris Whalen, president of South Shore Health Express, and we are talking about urgent care. We encourage you to send in any questions regarding this topic. We would love to hear from you. We actually just got one from Gloria. People need to be educated about what urgent care is for. What's your soapbox?
My soapbox is we're here to take care of any acute medical issue you have, which is not life-threatening. So if it's acute and you fell on your arm and you think it might be broken and it has to be seen and you might need some analgesics or painkillers, then we can take care of it in the most timely, cost-affordable manner of any form of healthcare in Massachusetts. So I think we're there for that. I think if you have a sudden fever, you're feeling horrible, and you're not so bad you have to go to the ER, which is the majority of the time, but you might have an early pneumonia and you need antibiotics. We can start that process for you and get you on the get you in the direction of getting healthier.
Okay. And again, we spoke about this a little earlier. This is not necessarily a service for patients who have ongoing care or need constant monitoring, correct?
Correct. But we will see, you said earlier, do we see Medicare? Yes, of course we see Medicare patients. Medicare patients are going to be more likely to have whether hypertension, diabetes, or other comorbidities just based on age, but they also have sudden rashes or sudden coughs, or they get a laceration from a kitchen appliance and that has to be fixed. So we will take care of those problems and be aware of their other comorbidities in our diagnostic plan.
All right, and one last question for you, Dr. Whalen. Your locations and hours, so let's give them to him again.
Locations are Weymouth, Pembroke, Plymouth, Abington, Quincy, Kingston. Can't believe I forgot my child.
Too many to count.
Yeah, so weekdays are 9 to 8 p.m. and weekends are 9 to 4 p.m. Couple sites are 10 a.m., so just check the website and you'll see it.
This was extremely helpful and certainly an education from me tonight as well. I thank you so much for taking the time to come in.
I enjoyed spending time with you. Thank you very much.
Thank you so much. We want to thank WCVB TV and South Shore Health for this opportunity tonight. And if you've missed this evening, please log on to onehealthyboston.org and you'll be able to check the whole thing out again. We'll see you. Have a great holiday. Take care, everyone.
Take care.